Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. Please have a seat.
Good morning, doctor. This is my son.
How can I assist you today? What seems to be troubling him?
He has been having high fever spikes, severe headaches, and sometimes he feels very cold. I'm quite worried.
That sounds concerning. Has he traveled to any areas known for malaria recently?
Yes, we just returned from a vacation in a tropical country last week.
Okay, does he experience any nausea, vomiting, or muscle pain?
Yes, doctor. He has been vomiting and complains of muscle pain and fatigue.
How old is he?
He is 8 years old, doctor.
Has he had any prior medical conditions or hospitalizations?
No, doctor. He has been generally healthy.
Is he currently on any medication?
No, doctor.
Any known allergies to medications?
Not that we are aware of, doctor.
And his immunizations are up to date, correct?
Yes, they are, but we didn't take any anti-malarial medication before traveling.
I see. Based on his symptoms and recent travel history, it is prudent to test for malaria. He has been showing classic signs, such as cyclic fever, headaches, and muscle pain. I would recommend a blood test to check for the presence of malaria parasites.
All right, doctor. How soon can we get the results?
Usually, it can be done within a day. If he does have malaria, we will need to start him on anti-malarial medication immediately. Chloroquine is commonly used, but the choice of medication will depend on the species of malaria parasite causing the infection and its drug resistance pattern.
Is the treatment long, and will he need to be hospitalized?
Treatment duration can vary, but it is usually for a few days to a couple of weeks. Hospitalization may be needed if the infection is severe, but if detected early, outpatient treatment can be effective.
What about after the treatment? Will he need follow-up tests?
Yes, after the completion of treatment, we will need to do follow-up blood tests to ensure that no parasites remain in his blood. Additionally, he should continue to use mosquito repellent and sleep under a mosquito net to prevent reinfection.
Thank you for the detailed explanation, doctor. We will get the blood test done as soon as possible.
You're welcome. Let's act promptly to get him treated effectively. After the blood test, we will discuss the treatment plan based on the results. Take care and don't hesitate to call if his condition worsens before the test results are out.
We will, doctor. Thank you again for your guidance.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. Please have a seat. How can I assist you today?
Good morning, doctor. My child has been feeling unwell, showing some rash and has a fever. I am really concerned.
I see. How old is your child?
He is 5 years old, doctor.
Has your child been experiencing any cough, runny nose, or red eyes?
Yes, doctor. He's been coughing and his eyes look a bit red and watery.
Has he been exposed to anyone who had a similar condition or anyone with measles?
Not that I am aware of, doctor.
Has he received his MMR vaccine?
No, doctor. We haven't vaccinated him yet.
Does your child have any history of previous illnesses, allergies, or any medical conditions?
No, doctor. He's generally been healthy.
Does your family have a history of any immunodeficiency diseases or any other chronic conditions?
No, doctor. Everyone is in good health.
All right. It seems like your child is exhibiting symptoms consistent with measles. I will have to order some tests, including a blood test, to confirm the diagnosis.
What kind of treatment will he need, doctor?
Measles is a viral infection, so there is no specific antiviral medication for it. The treatment mainly focuses on relieving symptoms, maintaining hydration, and preventing complications. If it is confirmed that he has measles, I will recommend bed rest, plenty of fluids, and fever-reducing medicines like acetaminophen or ibuprofen to control the fever and muscle aches.
I would also advise keeping your child isolated to prevent the spread of the virus to others, especially to those who are not vaccinated or have a weakened immune system.
Yes, doctor, I understand. Is there anything else we should do?
If the measles is confirmed, vitamin A supplementation may also be recommended, as it can help in reducing the severity of measles, especially in children with low vitamin A levels. Additionally, ensure that he receives balanced nutrition to support his immune system. Once he recovers, I strongly recommend getting him vaccinated to prevent future occurrences of measles and other preventable diseases.
Please remember that complications from measles can be serious, such as pneumonia or encephalitis, so monitor him closely and bring him in immediately if his condition worsens or if new symptoms develop.
Thank you, doctor. I'll follow your advice strictly and I'll ensure he gets the vaccine once he's better.
That sounds good. Please keep me updated on his condition and don't hesitate to call if you have any concerns or questions.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Mr. Thompson was brought in early this morning due to severe abdominal pain. He presented with nausea, vomiting, and a persistent headache. He's a robust 70-year-old with a history of hypertension controlled with medication. He's currently on a clear liquid diet and has no known drug allergies. He's at risk for dehydration due to his vomiting. We have him on IV fluids, and his body is responding well. His evaluation shows elevated white blood cell count, suggesting a possible infection. His vital signs are within the normal range. Blood pressure is well controlled, and he remains alert and oriented throughout my shift. At around 4.45, he was administered an antiemetic to control his nausea, which seems effective. He has a 20 gauge in his right arm, and he's receiving Ringer's lactate at 20 mL per hour.
Now look at question 26.
Please, everyone, let's have a brief conversation about maintaining sterile fields during surgery. It's reassuring to observe that the team is adhering to the revised protocols, leading to a substantial reduction in post-operative infections, a 35% decrease to be precise. Our internal audits reveal some insightful details, like breaches in sterility occurring more frequently during the initial phase of the surgeries than the concluding ones. The reason behind this is still to be ascertained, but it's a noticeable trend. Moreover, it's been identified that distractions and interruptions during the setup lead to oversights. Therefore, it's imperative to maintain focus and avoid unnecessary conversations during this time. Lastly, constant vigilance is required to prevent complications arising from surgical site contaminations and instrument sterility. Although we have managed to keep such instances to a minimum, the intricate nature of the surgeries we perform necessitates unwavering attention to detail.
Now look at question 27.
Good morning, everyone. Let's go over the new admissions we had last night. Sarah, could you please start?
Absolutely. We have John Doe in room 7. He's a 47-year-old male who was brought in by paramedics last night. He has a history of bipolar disorder with recurrent depressive episodes. Currently, he presents with severe depressive symptoms, including suicidal ideation and psychomotor retardation. He needs to stay in our intensive care unit until we see improvement in his mood and overall mental state. We will conduct 30-minute checks to assess his safety and monitor his response to initial interventions.
All right. I will assess his medical and psychiatric status later today. And what about discharge planning?
We are coordinating with a social worker for post-discharge planning and community support, scheduled for a discussion day after tomorrow. A legal review may also be necessary to assess his ability to make decisions regarding his treatment.
Very well. Let's discuss his case in more detail during tomorrow's meeting.
Now look at question 28.
Mrs. Walker, how may I assist you today?
Well, I have a few concerns about my son's vaccination schedule.
Okay, are you considering a vaccination at home, or is there another concern?
Well, many people have been suggesting I should opt for a vaccination center, but I would prefer doing it here where it's more comfortable and familiar for my child. However, I have concerns about the possible side effects and whether we can manage them at home.
Unfortunately, we can't administer certain vaccines without the appropriate medical setup due to potential immediate side effects. However, most routine vaccinations can be managed well with over-the-counter medications for any subsequent discomfort or fever.
That should be manageable.
And were there any adverse reactions after his previous vaccinations?
Yes, he developed a mild fever and was quite irritable for a day or two. It was manageable, and we are better prepared this time. I have educated myself about what to expect and how to handle minor side effects.
Now look at question 29.
How was your day, Emily?
I ran into a bit of trouble while setting up the feeding tube for Mr. Johnson. I've practiced the procedure multiple times before and felt confident. However, I hadn't expected his gag reflex to be so strong, making the insertion extremely difficult. Given his critical condition, he has had multiple intubations, which I believe could be the reason behind his strong reflex.
Yes, patients with frequent intubations can have heightened gag reflexes, and it can indeed be distressing if we can't set it up swiftly and efficiently.
He managed to stay calm throughout, though. I would have been far more anxious if I were in his shoes.
I'll be there to guide you through the next time you attempt it, just to ensure everything goes smoothly.
Now look at question 30.
So, I heard you've been having some trouble with your teeth lately. Is that correct?
Yeah, I ate some candy a few days back, and now it hurts really bad when I eat something cold or sweet. My dad thinks it's just a small cavity.
It seems like there is some inflammation and sensitivity around one of your molars. But I don't think it's just a small cavity as your dad assumes. Does it hurt constantly?
It throbs sometimes, but it's unbearable when I eat ice cream.
All right, it sounds like you might have a deeper cavity or possibly an infected pulp, typically resulting from untreated cavities. We'll need to get some x-rays to determine the extent of the decay and to decide whether a simple filling will suffice or if you'll need more extensive treatment, like a root canal. Let's not worry until we have more information.
Oh, all right then.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Today, we have the opportunity to discuss tetanus with Dr. Jane Mitchell, an expert in infectious diseases and a consultant at the Center for Infectious Disease Control and Prevention. Dr. Mitchell's recent studies illuminate the significance of tetanus prevention. Can you shed some light on the current state of tetanus, Dr. Mitchell?
Absolutely. Tetanus is a severe bacterial infection caused by Clostridium tetani, which primarily affects the nervous system, leading to painful muscle contractions. The World Health Organization estimates that in 2017, there were approximately 209,000 cases of tetanus worldwide, leading to 30,000 deaths. Despite being a vaccine-preventable disease, tetanus continues to pose a significant health concern, particularly in areas with limited access to healthcare and vaccination services.
That's alarming. What are the primary reasons behind the prevalence of tetanus in today's world?
Several factors contribute to its prevalence. The spores of Clostridium tetani are ubiquitous in the environment, found in soil, dust, and animal feces. Infection typically occurs when the spores enter the body through wounds or cuts and then release a toxin. A significant concern is that people in many developing regions are not receiving the tetanus vaccine, which is crucial in preventing the disease.
Can you delve a bit more into how tetanus is contracted, and is it transmissible between individuals?
Certainly. As mentioned, tetanus is contracted when spores of Clostridium tetani enter the body through breaches in the skin, such as cuts, burns, or puncture wounds. Once inside, they germinate and release a neurotoxin called tetanospasmin, causing the characteristic muscle stiffness and spasms. However, tetanus is not contagious and cannot be transmitted from person to person. It's fundamentally different from diseases like the flu or common cold in this respect.
What challenges do we currently face in diagnosing tetanus promptly?
Diagnosis of tetanus is mainly clinical, relying on the presence of characteristic signs and symptoms, as there is no routine laboratory test for confirming tetanus. This poses a significant challenge, especially in early stages when symptoms are mild and nonspecific. Early and accurate diagnosis is crucial, as delayed treatment can lead to severe complications and even death.
How long after exposure do the symptoms generally appear, and are there any accurate tests available for diagnosis?
The incubation period for tetanus is typically around 7 to 10 days, but can range from 3 to 21 days. Symptoms usually develop when the toxin reaches sufficient levels in the body. While there isn't a standard test for tetanus, clinicians usually diagnose it based on clinical manifestations, history of wounds, and immunization status. This makes maintaining accurate vaccination records crucial in managing suspected cases of tetanus effectively.
Given these challenges, what are the advancements being made in developing diagnostic measures for tetanus?
Several research institutions are currently exploring advanced molecular and immunological techniques to detect the presence of tetanus toxin or antibodies, aiming to develop a rapid and reliable diagnostic tool. Developing a test that can detect tetanus in its early stages is crucial to initiate treatment promptly, preventing complications and improving outcomes.
Once tetanus is diagnosed, what are the existing treatment protocols?
Tetanus is a medical emergency requiring immediate intervention. Treatment usually involves wound care, medications to control symptoms, and sometimes intensive care. The administration of tetanus immune globulin is crucial to neutralize the circulating toxin. Additionally, patients receive antibiotics to manage the bacterial infection, muscle relaxants for muscle stiffness and spasms, and proper wound care to remove the source of the bacteria. Vaccination is also administered to prevent future infections.
And finally, with the current treatment protocols, are we seeing a significant reduction in tetanus cases worldwide?
Yes, the global tetanus mortality rate has indeed decreased substantially due to widespread immunization efforts, particularly in infants and pregnant women. However, there remain regions where vaccination coverage is inadequate, leading to preventable cases and deaths. Continued efforts to improve vaccine access, enhance public awareness about tetanus prevention, and develop innovative diagnostic tools are paramount in the global fight against tetanus.
Thank you, Dr. Mitchell, for this informative discussion on tetanus and the ongoing efforts in its diagnosis, prevention, and treatment.
It was my pleasure to be here and discuss such a crucial healthcare topic. The more we know and share about tetanus, the closer we get to eradicating this preventable disease worldwide.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hello, everyone. My name is Dr. Sarah Anderson, and I'm a dermatologist specializing in skin pigmentation disorders at this healthcare facility. Today, I'd like to present a detailed discussion on a very common condition I encounter in my practice, melasma. But first, let's understand what melasma is and how it affects people's lives. Melasma is a skin condition characterized by brown or gray-brown patches, typically appearing on the face, primarily the cheeks, bridge of the nose, forehead, chin, and above the upper lip. It also can appear on other parts of the body exposed to the sun, like the forearms and neck. Although melasma does not cause any physical discomfort or other health complications, it can significantly impact a person's psychological well-being, self-esteem, and quality of life. Now, let me share a case study to illustrate the approach to managing melasma and the impact it can have on an individual's life. This involves a patient named Lisa, a 35-year-old woman who came to me with concerns about increasing pigmentation on her face, which was causing her distress and lowering her self-confidence. Lisa, like many with melasma, had been dealing with the condition silently, trying various over-the-counter products with little to no success. When Lisa first came to me, she was frustrated and felt hopeless about her situation. My first task was to understand what mattered to Lisa and help her understand the condition, its causes, and the treatment options available. I explained to her that melasma is often associated with sun exposure and hormonal changes, such as pregnancy or the use of oral contraceptives, and emphasized the importance of sun protection in managing the condition. The next step in Lisa's journey was creating a personalized treatment plan. We started with a combination of topical treatments, including hydroquinone, a lightening agent, and a strict sunscreen regimen to protect her skin from further damage. Additionally, we introduced laser therapy sessions to address the deeper pigmentation. The journey wasn't smooth. Melasma is a stubborn condition and requires consistent and long-term management. Lisa was sometimes disheartened by the slow progress and the recurrence of pigmentation. However, what kept her going was the understanding that managing melasma is a marathon, not a sprint. Regular follow-ups, lifestyle modifications, and her determination slowly started showing results. Lisa became more involved in her treatment plan, proactively discussing her concerns and following the regimen diligently. It was inspiring to see her reclaiming her life and her confidence. Over time, Lisa's melasma became more manageable. While it's a condition that typically requires ongoing attention, she learned to integrate her skincare routine seamlessly into her life. She is now more confident, empowered, and is using her experience to create awareness about melasma and its impact. Seeing patients like Lisa overcome their struggles and regain their confidence is incredibly rewarding. It highlights the significance of addressing not only the physical aspects of skin conditions, but also the psychological and emotional aspects, ensuring a holistic approach to skincare and overall well-being. Melasma may not have a cure, but with the right approach, knowledge, and persistence, it can be managed effectively, allowing individuals to lead fulfilling lives without being overshadowed by their condition. And witnessing this transformation, being a part of their journey, reinforces the profound impact we can have in our patients' lives as healthcare providers.